welcome back to At the Heart of Health. I hope you're enjoying our program today. With us, we have a very special guest, Dr. David Wynn, an electrophysiologist. We've been answering some questions about how the electrical system works, how we can help it function when it's malfunctioning. This is a very fascinating subject, but I'm going to get off the subject for a minute because I'm sitting here looking at you and I see a devil. What's that devil there I see on your tie?
It's not really a devil. It's just a D with a tail on it. And
it doesn't stand for devil, does it?
Blue devils, perhaps.
Oh, blue devil.
Yes, yeah.
Okay. But it's just not, it's just a symbol.
It's just a symbol. It's like the Demon Deacons or the UNC Tar Heels?
Tar Heels, yeah, I think that's the name of them.
Can't remember that
now,
one.
I went to school at the University of Texas, so I'm still a Longhorn. So I got the hook 'em horns. Well, that's let me go to the next question here. This is going to be an interesting one. This gentleman is 57 years of age. He's had a bypass surgery about 6 years ago. He says they measured his strength of his heart and his ejection fraction is 28%. He feels fine. Recently, his cardiologist has recommended that he considers a defibrillator, but he didn't explain it good enough for me. Could you shed some light on, do I need a defibrillator or not, and what's its pros and cons? So we're talking about, let's explain what a defibrillator is first.
Okay. And let me backtrack just a bit. So this number, this ejection fraction, is a number that probably everybody should know at some point in their lives. And when the heart squeezes, it ejects out a certain amount of blood, and then it saves a bit to reprime the pump, if you think in that analogy. And that number is 55% or more, and that's what we consider normal. So if you're down at 30%, you're working, or 25%, you're about half normal. And that number, when it hits that 30 to 35% level, has some very important implications for us as we go forward. We know that that group of individuals, particularly if they've had a heart attack or bypass surgery and they have what we call ischemic heart disease, that is, blood flow doesn't get to certain areas or there's scar tissue there, are at a much higher risk for what we call sudden cardiac death. That is, an electrical storm of sorts that makes the heart beat chaotically and doesn't allow it to get blood to the brain or to the rest of your body. And we know that in this country that there are hundreds of thousands of these episodes a year in various people, and sometimes people get through it, and these are the saves that you read about, and they're so gratifying that somebody could do CPR and get through it, but the majority of them never get to that point. So the defibrillator is a device that was built and put together really on the dream of one man, a fellow named Michael Mirowski, who was a Jewish cardiologist, and he many years ago was in training in Israel, and he and his wife were at a supper, and his chief of cardiology, who was a beloved mentor to him, passed out at the table, and he had something called ventricular tachycardia, and they resuscitated him and he did fine, but Dr. Mirowski was saddened by this, and his wife asked why, and he said, well, I know this is going to happen again and eventually he's going to die. And it, as in so many things in life, it was this realization on the part of one man that triggered a passion in him to develop a technology that would prevent that from happening. And he went to medical schools, and Hopkins finally gave him a little closet across the road from the medical school and said, you can play with what you want, but don't bother us. And I can remember seeing films of a meeting when he finally had put this together, and he brought a dog out on stage, and the dog went into cardiac arrest, and this device detected the rhythm, delivered a shock, and the dog walked off the stage. And the whole group of cardiologists, if you can imagine this, stood up and applauded. And it was at that point that we realized that, or people realized this was something that was potentially going to change the world. But even then, getting a manufacturer to, I mean, he went through an awful lot of grief to get to where we are today. But the device itself has come through a number of iterations. This is kind of one from about 15 years ago. They were even bigger at one time. This is what they look like today. And this is components are really a battery and a capacitor, and then a computer system that detects the rhythms, determines whether they are life-threatening or not, and then triggers the device to either pace or deliver a jolt of energy to get the heart and get it back in rhythm. It's like having your own EMT right there in your home and in your heart. And any of you who have lived through the death of a relative or have a relative who has had heart attacks know that there's always a certain degree of fear. Is this going to happen again? What if it does? What's going to happen to my husband or wife or child? And this is one technology that, if applied appropriately, can save lives and prevent a catastrophic event.
And what is that made out of?
It's a titanium shell, and it's got lithium iodide crystals. The capacitor, you know, I'm not sure I can tell you. There is a book called Machines in Our Heart, which is a wonderful book that talks about how these are made.
Well, the reason I ask is you always get questions, you know, can I get an MRI? Can I get a CAT scan? Can I have dye? Can I go through the airport? Microwaves, cell phones, you know?
Right, and so these are all, so microwaves are safe as long as you don't climb inside the microwave.
Okay, I think we're safe there.
Okay, so don't do that. MRIs are, at this point, still not safe. They are developing shielding to
How about if you're just getting below the waist on a leg, or you're not getting all the way to the magnet?
That's a good question. There are institutions in the country that do that. University of Michigan has been very proactive in doing MRIs with these devices, but most institutions don't, more for liability than anything else. But that's going to change in the next few years. The airport flying is still an issue. If you go through security, you're going to set off the alarm. They'll think you're a terrorist, and so you need to tell them that this is real, I've got a card, this is in me, and I'm going to trigger that potentially.
Now, getting back to our question, we've talked about what it is. It'd probably be beneficial to him. Should he do it? I mean, he's not having any symptoms. He's young. I mean, he's otherwise pretty healthy, just has a bad heart.
So my recommendation is if he comes to me and this is my dad or my cousin, I say, you need to get this. Right. But as you know, there are a lot of things that go into that decision. There are a number of well-controlled, blinded or trials that have gone out and proved the efficacy of these devices. They can reduce sudden death to pretty close to what a normal person would have.
So they've done studies that show that people that have these with low ejection fraction, even they feel fine, more of them are going to be alive than not.
Because many of them will have this episode of sudden death at some point in time.
I think that's an important distinction, because a lot of information out there is not based on randomized trials.
Right.
You know, whether it be a nutrient or some other treatment, there's not proven truth. And also, different parts of the world treat different parts. Now, is this standard treatment in Europe and other parts of the world?
It's certainly standard treatment in industrialized countries. I think, and you and I have talked over the years about the cost of technology, that in non-industrialized countries, sometimes the cost of these technologies are more than the economy can afford. Many of these companies donate these devices in those settings. But in in Europe, in China, in Japan, in the United States, Russia, this is standard therapy now.
Well, I hope that answered your question. Now, we probably don't have we have a question about ablation here, but we probably don't have enough time to fully give it the time we need. But I have ablations when you go up and destroy those dangerous rhythms in the heart. Something we do pretty common. But I have a question. You do a lot of these procedures, Dr. Wendt, and you know, when you're at a table and something goes well and something goes wrong, do you ever feel the presence of God with you? I mean, do you feel that higher power sometime that helps you get through these a tough procedure, or when something's not going well? Do you ever call on that power?
Yeah, I think the answer is obviously yes. In many respects, if I have prepared myself mentally and emotionally and spiritually, I'm there, but I kind of try to step out of the way and let God just work through that time. And you know, there are times when you just feel like you're in this zone, for lack of another word, where you're a conduit, and the things are doing what they're supposed to do. God is just letting things smoothly go. And then there are other times when they don't go so smoothly, and of course you go, gee, you know, it quickly run through a checklist in my mind. Have I been arrogant? Has there been a bit of hubris on my part, thinking that I could do something I really can't? Am I just tired? You know, what's going on? Do that quick checklist and then kind of get back to business again. But unfortunately, medicine is the ultimate humbling profession, because there are things that are out of our control.
There's risks,
and
there's poor outcomes.
Yeah.
Even if you do everything by the book, sometimes things don't go as you like it to.
And I think that's so important. You know, patients come and they say, you know, what can I do to prepare for this? And I will tell them that, you know, and some of them will come in and say, gee, we're going to pray for you. And I say, gee, that's great, because in the best of hands, there are unknowns anytime you get into a operation or a procedure. And I'll take all the help I can from that end of it. So.
Well, one of our mottos and one of the things that has given me comfort is when there's someone coming comes to you and you can't do anything more. You can't help them anyway. And I say, listen, yes, we can help. You know, there is ultimate healing. We've been promised that. You know, you will be healed someday. And just seeing that, when they give them that hope and let them know they're healing, that does something. Right. And that sort of led to our motto of our programs this year on at the Heart of Health. We call it at the Heart of Health because at the heart of health is love. Right. Now, an electrophysiologist might say at the heart of health is a sinoatrial node. Right. But at the heart of health is love, because when you have love in a life, everything else seems to fall in line. Right. And when you don't have this, you know, it really, it's a healing force. Right. We know that people with dogs and cats, they live longer. People with happy relationships do better. So in addition to modern medicine, in addition to all the different things we can do for lifestyle, we also want to point people back to love as a healing force.
I think that's right. And the hope is that by allowing people the opportunity to get through these crises, to live longer, that they can go back in and be with their family, repair the relationships that are a bit frayed, and really experience the love of that community.
Hi, I'm Dr. James Marcum with your Daily Heartbeat. I have a saying I like to say, and it's this: it's at the heart of healing is love. Now, what would that mean, and what would that have to be with healing? But did you know that love is a way that we can change our body's chemistry? There's been studies done that show people that have animals, which could include a dog or a cat, if they have them, they actually have less heart attacks, less stroke, less infectious diseases, and even less malignancy. Well, do you think it's anything about these animals yelping and barking and meowing that changes the chemistry? No, it's not. It's the love that's shown between owner and manual. Likewise, we know that people that are happily married, if one of the spouse should suddenly die or get sick, that there's a greater likelihood of the other spouse developing a disease. So at the heart of healing is love. And love is one of the most valuable treatments we have to stay healthy.